You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to MaternalRx on the Pharmacy Podcast Network, where we empower pharmacists to drive change across the pharmacy journey from preconception to postpartum. With maternal health in crisis, pharmacists have the power to bridge critical gaps in care. Today, we're shining a light on endometriosis, a condition that too often goes undiagnosed, and exploring how pharmacists can make a lasting impact for those affected. Quick disclaimer before we get started, this podcast is for education only. Please consult your healthcare providers for medical advice. Everything I share on this podcast is strictly from my own experience and education and not a reflection of any company where I work. I'm Dr. Danielle Plummer, pharmacist, and your host for today's interview. I am so excited for our guest today, Dr. Elif Polat, a passionate physician and researcher whose work focuses on improving outcomes in reproductive health by bridging together medicine, advocacy, and education. She's a medical doctor who holds several very unique certifications, including health equity research and practice, local and global lessons in bioethics, the law, medicine, and ethics of reproductive technologies and genetics. She's also a member of both the American College of Cardiology and American College of Obstetricians and Gynecologists. She serves as the Turkey representative for the Worldwide Endomarch, a global movement dedicated for raising awareness and advocating for people affected by endometriosis. Through events, campaigns, and educational programs, she's helping to bring much-needed attention and support to this important cause. Her mission is to make a real impact as a physician, scientist, advancing medicine while improving the well-being of patients around the world. Today, we'll be talking about endometriosis, global awareness, and advocacy, infertility, and how healthcare professionals, including pharmacists, can get more involved in spreading awareness. So, Dr. Polat, thank you so much for joining us today. I reached out to you because I saw some of the work that you were doing on LinkedIn and thought, I never learned this. Probably most pharmacists haven't. And what can we do? And I'm just so grateful for you to bring your expertise, which is so unique and different from anyone else that I've interviewed and other clinicians that I've met. And I would like you just to add any details that I might have missed in the introduction and tell us how you got involved in improving outcomes for endometriosis.
Hello, it's so nice to meet you, and thank you very much for the invitation today. I'm really excited to be here because most of the experts that you actually interviewed with, I've been following them for such a long time. So it is so important, and it's such an honor for me to be here today. And thank you for your kind introduction as well. I've been working in the women's health area and women's health advocacy for 4 years, and actually more than 4 years now. And I've got involved with Worldwide Endomarch 4 years ago. Dr. Kamran Najat, the founder of the Worldwide Endomarch and the father of the modern laparoscopy, is like one of my idols. And today that I've been working with him, I'm so happy to be working with him for 4 years, and he's like kind of a mentor for me. Like I have an endless, respect to him and his work. So it's totally an honor for me to represent Turkey in the global arena on behalf of Worldwide Endomarch. Because, women's health affects men's health at the same time. So it's so important to let everyone know about endometriosis and let them get information starting from the teenagers to the adult ages. So we can talk about endometriosis and the symptoms of the endometriosis. I just want to mention what is endometriosis at first and what are the main symptoms of it. So endometriosis as a medical condition where the endometrial tissue grows in other places outside of the womb, we can say that, and such as the reproductive organs like ovaries and fallopian tubes. But endometriosis is actually a multisystemic disease that can affect anywhere of your body. So with the less commonly, endometrial tissue can go further from your womb and has been found in the digestive system or like urinary tract, even lungs, even diaphragm, even breast, eyes, or anywhere else in your body. And at the same time, I want to emphasize that like the womb lining, the endometrial tissue reacts, of course, to the hormones in your body. So that can cause blood and that can bleed. But at the same time, if the blood is unable to leave your body, that can cause inflammation, pain, or like the scar tissue in your body. And that's going to cause pain and inflammation again. So it's like a cycle.
We had no idea that it goes outside and can affect any organ in the body.
Yeah,
And this
it can
explains
affect
why,
any organ. Yeah,
yeah, this explains the systemic pain that women with endometriosis
of
have.
course.
And you brought up a good point. It's not just affecting the female, it's affecting the families as well. I looked at some statistics, and endometriosis affects an estimated 10% of women of reproductive age worldwide. You're looking at 190 million women. In the United States, it is estimated to affect between 5 to 10% of women. And I want to quote Dr. Marlena Fejo, who fortunately, have been able to work with and is a really just fundamental in improving care for women with a disease that I suffered from, hyperemesis gravidarum, who just 2 days ago posted on her LinkedIn profile a statement. She said, "We put a man on the moon half a century ago, but it still takes 10 years to get an endometriosis diagnosis."
Yeah.
Why, Dr. Polat? What is going on here?
We can say that I can actually mention the importance of the symptoms of endometriosis here, because there are some very common symptoms that patients could have been experiencing for such a long time, and sometimes even being gaslighted or like getting manipulated because of this. The first and one of the most important symptoms of endometriosis is pain, pelvic pain, painful periods that could have been affecting your everyday life, pain during or after sex, or like pain when you're peeing or like pooing during your period, or like tiredness or fatigue. These are not like specific symptoms to one of the diseases, especially to endometriosis. Most of the diseases could have caused pain or like tiredness or fatigue. So I don't actually mean that, definitely not meaning that if you have these symptoms, you have endometriosis. But endometriosis could have been one of the reasons behind these symptoms. So most of the patients that's been experiencing that kind of pain, or like we can say, by the way, the butt pain, leg pain, shoulder pain is mostly depends on the place where the endometrial tissue has thrived in. So if you have shoulder pain, you could have had endometriosis in your diaphragm, and you could have been experiencing even shoulder pain. So there are some cases like endometrial tissue in the eye and keeps bleeding in every period of these patients. So pain is one of the unspecific conditions and symptoms behind most of the illnesses, we can say. But and it's not totally specific to endometriosis. That's why most of the women could have getting manipulated even in their cycles or like periods. And I just want to say to all of these women, if you're experiencing that kind of pain, like monthly in your period, or like you have the other symptoms, we can say heavy menstrual bleeding, spotting, like feeling sick, even depression, back pain, leg pain, or like butt pain. If you're experiencing this kind of symptoms, and you are being told that this is in your head, this is not obviously in your head. The pain is real. So you should see your doctor, and you should get your medical advice from your expert to talk about endometriosis. I just want to mention again, endometriosis is not the only diagnosis behind all of these symptoms. Most of the other, organic causes can cause these kind of symptoms, but endometriosis should have been considered one of the possible diagnosis behind all of these symptoms again.
And that explains why it takes so long to get the correct diagnosis. So
Yes.
we see this with many of women's health issues, non-specific symptoms, overlapping symptoms, and it's a disease, it sounds like to me, a disease of rule out. Is that a correct way to say it?
Yeah.
So you would have to go, well, it could be this or it could be that, and go down an algorithm until nothing else has created a solution. You're still experiencing pain. What do you
Yes.
do now? What type of diagnostic or prognostic tests might be available when a woman goes to the doctor?
So in most of the times, like women are having like MRIs, CT scans, ultrasounds to
Wow.
um, to understand what causes this pain, especially if they're experiencing like a pelvic or abdominal pain. Because one of the first things that's coming to mind there's something wrong with your reproductive system if you're experiencing pelvic
Mhm.
pain or like abdominal pain. So they're going to their doctors and they are getting MRIs, CT scans, and ultrasounds. But we have so many patients that still MRIs, CT scans, and ultrasounds are clean, but still have endometriosis. So at this point, the hysteroscopy could be useful. And hysteroscopy is being performed to these patients to diagnose if there's an endometriosis. Because, this is one of the not easiest way in a medical term, but easiest way to see what's going on inside the organs. So hysteroscopy is kind of a laparoscopic system that you can just see inside the pelvis, and you can see the organs in the reproductive system and basically in the uterus. And if there's an endometrial tissue outside of the uterus, you can just see it and diagnose endometriosis and take it out.
And what type of specialist would a woman want to see to get this procedure done?
OBGYN specialists and their endometriosis specialists like Dr. Nejad are taking care of that kind of surgical procedures.
You probably see women traveling from far away to get the
From all
procedure done,
around
I
the
would
world.
guess, from around the world.
Yeah.
And they're coming because they're not getting that diagnosis correctly where they are, or maybe they're being told you need this procedure, but nobody near them offers that. In the United States, we have these what we call maternal deserts. We don't have OBGYNs in so many counties, and it's really not good for the women, right, who live around and need to travel far. But I'm just grateful for people like you and the team that you work with to offer this procedure to get women this diagnosis after so much time has passed and being, like you said, gaslighted, right? Of
Yeah.
course you're tired. I bet they have anemia too. They have, like we said, these overlapping symptoms. Not, that how do you make that correct diagnosis? You have to go to where the experts are and get the right treatment to find out, or right diagnostic tool and test done to find out.
It's not just about the actually OBGYNs, like in all of the medical fields, and medical experts should be consider endometriosis as one of the diagnoses, like possible diagnosis, because sometimes in like most countries in the world, uh, physicians are so uh, getting specialized with their area, and sometimes it just be being forgotten about the endometriosis. It could be one of the health conditions that should be considered as the cause one of these symptoms. So it should be considered by all of the medical experts in the field.
And I say that always through every interview, through all my different work experiences, multidisciplinary care leads to the best
Yes,
outcomes.
definitely.
So in this case, we want to make sure our pain management doctors understand, our psychologists or other mental health providers are aware of it. Fertility experts, right? So how would endometriosis affect somebody who's trying to become pregnant and would like to grow a family?
Yeah, this is an important point because most of the times there is like unexplained infertility or like we can say endometriosis associated infertility at some point, because endometriosis, we said is can be difficult to diagnose, as many of the symptoms are similar to other conditions, and it doesn't always show up on the scans. And for so many women, it takes years to find it and figure out they have endometriosis. And from the perspective of infertility, we can say that endometriosis does not necessarily cause infertility. Like there is a possibility that you have had like totally healthy pregnancies, totally healthy babies, and you didn't experience any kind of pregnancy complications, and you delivered like totally healthy babies, but you could have still have had endometriosis without any symptoms. So we don't say that endometriosis causes infertility 100%. This is not true. But there is an association with fertility problems with the endometriosis. Even with severe endometriosis, natural conception is still possible. But we can say that for women who do not have endometriosis, the monthly pregnancy rate is like between 15 or like 20%. But for women who have endometriosis, the chance of getting pregnant in a single month of trying is between 2 and 10%. So we can say that if there's an unexplained infertility, endometriosis could be one of the causes behind it. But we definitely need to mention that you still have and can still have endometriosis, and you can still experience 100% healthy pregnancy. So that's why, for me, this is one of the hardest parts of this medical condition, because we don't definitely know what causes endometriosis, and there is no exact cure for it. So in terms of the pregnancy and infertility, there are some, procedures could be performed for it, like IVF or like IUI, we can say, for the infertility side. But we can definitely say that since we don't have the exact pathophysiology behind endometriosis, and we don't have exact cure for it, it makes harder to control all of these sides and treat all of these sides of endometriosis.
This is where advocacy really plays the most important role, right? You said something very powerful. We don't know the exact cause. We don't have an exact treatment. So what do we do, right? And there are methods. This is where we want to get pharmacists involved. If you have patients coming into your retail pharmacy, or they're in the hospital for other procedures, and you're talking to them and they're saying, I've been wanting to grow a family. I'm having a hard time getting pregnant. Nobody seems to know why. Tests are coming out normal, or I'm in a lot of pain. Again, imaging's coming out normal. What do I do, right? Bring this to light. Talk to your doctors and say, is it possible I have endometriosis? Can we start the testing to see if this is something? And then if I do want to have children, what are my odds? Let's improve those odds. Like you said, let's give hope to everyone out there trying, because it's not impossible. It is possible for you then to become pregnant. It might just be a longer journey. So last year I interviewed Dr. Katie Wood, who specializes in people that are having difficult getting pregnant, to shorten that journey. Traditional guidelines say wait a year before you start other testing, because even for healthy women and their spouses or significant others, it can still take a long time to become pregnant. It can still take many months. So how do you know if it's just natural occurrences or there's something underlying that needs to be addressed? And I am so grateful for you bringing this to light, that give everyone hope. It is possible, but ask the questions, because not always are the clinicians bringing this to the conversation.
So it still could take time to get pregnant, like after years of trying. But if you're a patient that's been experiencing that kind of symptoms for years, especially starting from the young age, and you have having a hard time to get pregnant at the same time, that at this point you could see your doctor and tell everything about your medical history. Like you've been experiencing that kind of pain and you didn't tell before about your doctor about this, and now you're having hard times to get pregnant. That should be like kind of a symptom for your doctor as well to think about endometriosis. So your doctor can suggest you to have a hysteroscopy if you're like the other scans are clear and your tests are normal, but you're still having that kind of hard experiences. Now that could be a time to do a hysteroscopy and see what's going inside. But we could say that hysteroscopy is not always being considered. So if you need to see your doctor, because everything should be patient oriented and patient specialized. So I don't want to say that hysteroscopy is the only way to do it. So everything should be considered to your medical history, your family history. At this point, I want to actually mention that, yes, we don't know about the endometriosis background and like pathophysiology now, but there are so many research that's been mentioning the other factors like, behavioral traits, dietary preferences, or like smoking, alcohol intake, or like caffeine intake, genetics, family history. So there are so many the other kinds of approach to talk about endometriosis.
For those of us not familiar with hysteroscopies, so I'm looking this up, inspection of the uterine cavity by endoscopy with access through the cervix. Is it painful? Is it not painful? Do they get pain meds for it? My goal is just to keep women calm so they know what to expect for something. It seems somewhat invasive, but maybe it's considered a non-invasive.
It's an invasive approach, and hysteroscopy is basically a kind of a laparoscopy approach to the uterus and like the other pelvic organs. You are taking anesthesia to get it because it's the surgical procedure. So you should be talking about this with your doctor, because it should be all the medical approaches should be patient specific. So if you are being seen that you're in the need of hysteroscopy, then you should go for it. I don't recommend to you go to your doctor and get hysteroscopy. This is not true. This is definitely not true.
After we've ruled out these other potential diseases that could be causing these symptoms, then this would be your next step in the process, potentially.
Yeah.
Perfect. And what can pharmacists do when they see these patients saying, I have this pain? There, maybe, we mentioned how psychiatrists or psychologists or mental health providers might be involved because these patients are potentially depressed. You mentioned pain management, right? So they might be coming to the pharmacy for pain medications, for antidepressive medications, for hormone replacements. And I know our conversations today is not about medication management, but about advocacy. And this is where, like I mentioned, pharmacists then can say, hey, have you discussed the potential of having endometriosis with your provider? Do you have other suggestions on what pharmacists can do?
So I just want to say one more thing about the before talking about pharmacists, because it's an important point of all of the conversation. But I just want to say that in terms of the infertility and getting pregnant, I can say that some studies suggest that women with endometriosis have a higher risk of an ectopic pregnancy, because if the endometrial tissue placed in your fallopian tubes, for example, there is actually higher rate for you to experience an ectopic pregnancy, which is a health-threatening condition. So I just wanted to mention that because it's a very important point of the endometriosis. And there is another misconception about endometriosis. Most of the people think that pregnancy can cure endometriosis, but pregnancy actually doesn't cure endometriosis, but for many women, the pain improves during pregnancy because their periods stop. Endometriosis is actually is a hormone-dependent condition and mainly driven by estrogen. So, and endometriosis is actually influenced by progesterone resistance and inflammation. So, we don't say that endometriosis only depends on the hormones, but endometriosis is an inflammatory disease and a hormone-dependent disease at the same time. So in terms of the hormones, there are, we can say that hormones involved in endometriosis, there is a couple of hormones. Like we can talk about estrogen, we can talk about progesterone, we can also talk about prostaglandins and inflammatory mediators. And at this point, there are some effects of these hormones, of course, to your body. So at this point, pharmacists gets really important place to treatment of endometriosis, and not just because of the medical treatment options, but the emotional support, because endometriosis affects patients' lives and like well-being so much, not just by the way their psychiatric condition, but all their families or their beloved ones. And this is so important to make them feel that they're being taken care of. So I want to thank you at this point for doing this. It's really matters for so many women and so many actually people in this world that you are actually voluntarily doing this. This is so important.
Absolutely, my pleasure. I know you're as passionate about improving women's health as I am, and so many other people I get to work with. And I'm just grateful to have these connections and colleagues to share their expertise. Tell me, I know you do something very exciting, which was probably the first reason I reached out to you. What is EndoMarch? How can we get involved? And when, where? Tell us all about it.
So, Worldwide Endomarch is a global endometriosis foundation and based in Palo Alto, California. And the founder of the Worldwide Endomarch is Dr. Kamran Nejat, who has the father of the maternal laparoscopy at the same time, and one of for me, the best endometriosis expert in the world. So he has found this foundation to help women all around the world and support them and make them support each other by the endometriosis advocacy, and let them, for me, endometriosis, especially representing Turkey in the global arena on behalf of Worldwide Endomarch, is so important for me because in this time that I've been involved in 4 years, actually 4.5 years, I had a chance to, starting from the medical school, I had a chance to hear so many stories, so many women's stories, so many, teenagers' stories, and that's had no chance to stand up for themselves and talk about their stories. So I have a voice to speak up for the other women. Even I don't have endometriosis. I have never experienced that kind of pain in my life. But this is so important for me to be their voice and tell whole the world about these women's stories. This is so important because, as I said before, women's health affects men's health in every aspect. So not just women, but for men, they should know about endometriosis and they should be supportive. They should be helpful for their partners because, today you don't have even to have a uterus to have endometriosis. You may have underwent hysterectomy, and after you figured out you have endometriosis. So this is so important to know about this disease and support their partner that this pain is real and I'm with you. Like saying that I'm with you and I support you is so important, starting from the teenage to coming to the adult life. So for standing up for the endometriosis and talking about endometriosis, it's not just women's health. It's not just about women's health. It's about actually like the adolescent health, like the young girls, young boys, because letting them know about this disease in the schools, in the daily life is important. Because there are so many countries in the world today, women's rights are not being considered as human rights. So this is so important to let them know they are being, taken care of by the physicians and like by women and men actually, and they are, they are just they need to know this, So this is so important. Like if I had trained for humanities health, and I'm so voluntarily doing this. Like this is so important for me to help people, because I know that even these seconds that we're talking now, is somewhere in the world people are just dealing with pain or like dealing with some kind of health conditions, and I want to help them. So you don't have to know everything about endometriosis to start to advocate for women's health or like endometriosis health, but you need to be you need to volunteer to learn and tell the other people how important this disease is. So I'm really so thankful to you to get in touch with me and asking me for talking about endometriosis, because it is so important for me to let them know that someone is still taking care of them.
Dr. Polat, we have listeners, not visual watchers, so no one else can see you, but you just light up, you glow just talking about this. And to not having had gone through this, which I'm grateful, right? And to be this advocate and this expert in this space, I know you're doing work that we're not even tapping into today that's really going to have profound outcomes for these patients. Thank you as well. I just get chills kind of thinking about it, because there's so many women's health diseases that, as you mentioned earlier in the interview, they get gaslighted, right? Of course you're in pain. Of course you're tired. Well, not of course you're in pain, but is that pain in your head, right? And this has gone on for decades, for centuries for that matter, right? From the beginning of time. And I love how you're getting the men involved as well, the other family members, for these patients to understand this is a real disease. We see it on scans. We don't have the exact diagnostic tools. There's no specific treatment. We want to lessen the burden of this to have the best patient outcomes. And that's where this advocacy comes into play. So I know the next Endo March is literally in March. Is that correct?
Yeah. March is an endometriosis month, so there are so many, stuff actually going on all around the world. And we have annual meetings as a Worldwide Endo March, we organize annual meetings in every March to talk about endometriosis with world-renowned experts and global volunteers from all around the world, from all the countries. So it's a huge event, actually, that's being held in every March.
And where would patients go? Is there a website? How would they find more, patients and clinicians, to find out about this upcoming event?
Oh, you can just Google Worldwide Endo March, and it's just going to let you know about all the Worldwide Endo March events that will be done in next month. So you can just Google Worldwide Endo March, and you can go to the website.
Perfect. And I hope everybody does this. I learned so much from you, beginning with endometriosis can affect any organ in the body. The eyes. Have I ever seen anyone with like bloodshot looking eyes and they're saying they're in pain and they're tired?
Yeah, I was shocked as well. Yeah, I was a medical student when I just first read about that case. It was totally shocking, like knowing that patients with endometriosis in their eyes. Yeah, in every cycle, her eyes were bleeding at the same time with her uterus. So
it's just incredible. to be aware they're non-specific overlapping symptoms. This is the disease of rule out, which is why it takes up to a decade or more to get the correct diagnosis. And hopefully moving forward that we will have better tools in place, better treatments. And for those who want to grow a family, they want to become pregnant, stay positive. Let's get that inflammation down. It seems like a lot of the causes of this are just all over the board, and some may be controllable, but many are not. Like you mentioned, genetics. Inflammation seems to be the root cause of so many diseases, and we're looking what can we do with our diet, with exercise to decrease inflammation, but it's pretty much unknown whether that approach will decrease endometriosis rates and improve outcomes. So I'm looking over to my functional and integrative pharmacist and medical colleagues to start exploring that as well. And for all the colleagues I have out there and everyone listening, please go ahead, Google endometriosis, EndoMarch, and do what you can to create awareness and improve outcomes for these patients. Dr. Polat, thank you so much. Any last words of wisdom or advice you'd like to add?
I just want to thank you so much for getting me involved in your podcast series. This was my first time talking in a podcast as a guest speaker, so I was so excited to be here, and I'm still. So thank you so much for getting me involved in your podcast. This was really so exciting for me, and thank you for just your voluntarily talk. Wanting to talk about endometriosis is so important, and thank you very much for this.
Absolutely, my pleasure as well. The first interview for your podcast, the first of many to come. Your face, your voice just shines. It just glows and gives hope to so many women and their families to help understand this. And thank you as well. I look forward to many more interviews and better outcomes in the future.
Very much. I appreciate your support. This is so important.
Thank you so much for listening to my interview with Dr. Elif Polat about endometriosis. For the pharmacists still listening, I thought it would be important to share some final thoughts. For one, what is it? Understand this disease clearly. It's a chronic estrogen-dependent inflammatory condition in which endometrial-like tissue grows outside of the uterus. This causes pelvic pain, dysmenorrhea, dyspareunia, and infertility. The symptoms may also be nonspecific, presenting as bowel or bladder pain and chronic fatigue. Because of this, diagnosis is often delayed 7 to 10 years, and pharmacists are in the perfect place to help shorten that gap by recognizing red flags. If you do speak to patients with endometriosis, counsel effectively. Emphasize treatment adherence and realistic expectations. Pain improvement may take 2 to 3 cycles, for example. Discuss side effect management like bone health, mood, libido, and bleeding changes. Encourage consistent pain tracking to assess response, and educate on non-pharmacological support like diet, exercise, stress reduction, and physical therapy for the pelvis. Support multidisciplinary care. As mentioned in the interview, collaborate with your gynecologist, your pain specialist, your psychologist, and your fertility experts. Pharmacists can coordinate care and ensure medication reconciliation when switching between hormonal agents and/or surgery. Advocate and destigmatize. This is the most important thing we can do. Through my life, I have met so many women with pelvic pain or severe pain during their menstrual cycles, and they have just been dismissed, not believed, spoken behind their back, and this is unacceptable and needs to stop. So please do your role. Many patients experience dismissal of symptoms, and pharmacists are in the perfect place to validate their experiences and encourage follow-up. Raise awareness that severe period pain is not normal. And thank you so much for everyone listening for what you do to improve women's health and the pregnancy journey.